According to the Mayo Clinic, anemia is a condition in which you lack enough healthy red blood cells to transport an adequate level of oxygen to the body's tissues, and it is the correct thing to do. People have the wrong idea that anemia only means numeric deficiency of red blood cells. Well, no, it is simply the deficient of healthy red blood cells. That means that a person can have a large number of red blood cells but they do not have the ability to transport oxygen. For this reason, the anemias that we will talk about in the next videos will be 1. Aplastic anemia, which is this video. 2. Sickle cell anemia. 3. Iron deficiency anemia. 4. Autoimmune hemolytic anemia, and finally pernicious anemia. We will see if we add the rest of anemias to this series. Aplastic anemia. Aplastic anemia is a failure of the bone marrow of various causes and characterized by the destruction or suppression of parents with pancytopenia. But what is pancytopenia? Pancytopenia is the condition in which the number of red blood cells, white blood cells and platelets in the blood is lower than normal. This occurs when there is a problem with the blood-forming stem cells in the bone marrow. Epidemiology and demography. There is no predominance of age or sex in the acquired form. The annual incidence of aplastic anemia in the USA is 3 to 9 cases per million inhabitants. Signs and symptoms. Among the signs and symptoms of it are skin paleness, ecchymosis, petechiae, retinal hemorrhage, possible fever, mouth and tongue ulcers, pharyngitis. Short stature or skeletal or nail alterations are possible in the congenital form. Possible audible systolic ejection murmur and severe anemia. Etiology. Most of the patients with acquired aplastic anemia, marrow failure is due to an active destruction of the immune mechanism of blood-forming cells by lymphocytes. The frequent etiological factors in aplastic anemia are toxins such as benzene and insecticides, drugs such as phenylbutyrol, cimetidine, busulfan, and other myelosuppressants, also gold salts, chloramphenicol, sulfonamides, trimetadione, quinacrine, phenylbutazone. Ionizing radiation. Infections such as hepatitis and HIV. Idiopathic. Hereditary, also called Fanconi anemia. Other causes as well as immunological causes and pregnancies. Differential diagnosis. We have to differentiate this disease from others that may similar it, such as medullary infiltration by lymphoma, carcinoma or myelofibrosis. Severe infection, hypoplastic acute lymphoblastic leukemia in children. Hypoplastic myelodysplastic syndromes or hypoplastic acute myeloid leukemia in adults. Hypersplenism and hairy cell leukemia. Assessment. The diagnostic evaluation mainly includes a bone marrow aspirate with biopsy and laboratory tests such as BHC and smear studies. The spinal examination usually shows scarce or complete absence of erythroid or myeloid precursors. Patients with pure red cell aplasia may show only absence of red series precursors in the spinal cord. Lab tests. BHC shows pancytopenia. Macrocytes and toxic granulation of neutrophils can be observed. In early stages there may be isolated cytopenias. Reticulopathies. Initial laboratory studies should also include HEM tests to rule out paroxysmal nocturnal hemoglobinuria and tests for hepatitis C. Imaging diagnosis. Chest radiography. Ultrasound and computed tomography to assess splenomegaly. X-ray of the hand and forearm in patients with constitutional anemia. Computed tomography of the thymic region if a red blood cell aplasia associated with a thymoma is suspected. Treatment. As always, we have 3 types of treatment. 1. Pharmacological treatment, consisting of interrupting any drug or substance responsible for the etiology already mentioned above and assessing bone marrow transplantation. 2. Acute treatment, which will consist of an aggressive treatment of neutropenic fevers with parenteral broad-spectrum antibiotics. Platelet and red blood cell transfusions, on demand, although transfusions should be avoided in patients who are candidates for bone marrow transplants. immunosuppressive treatment with antithymocyte globulin, GAT, associated or not with cyclosporine, CSP, GAT with prednisone, 1 to 2 mg per kilogram daily initially, to prevent serum sickness. Transplantation of allogenic bone marrow precursors or peripheral blood from a compatible sibling usually lasts the underlying marrow failure. In patients with severe aplastic anemia, they are not candidates for bone marrow transplantation. High doses of subsequent subtransplant cyclophosphamides can be used as a third initial therapeutic option for the disease. And finally we have the chronic treatment, in which it must be done, long-term monitoring of the patient with physical examination and routine laboratory studies to control relapses. GAT with CSP recovers hematopoiesis in 2/3 of patients, however, recovery of the blood cell count is usually incomplete and repeated pancytopenia requires immunosuppressive treatment. Patients who do not respond to immunosuppression treatment have a poor long-term prognosis and should be considered for unrelated donor bone marrow transplantation. There is little justification for testing corticosteroids as the primary treatment or for their long-term use to prevent bleeding. Forecast: patients with severe aplastic anemia who undergo a bone marrow transplant before transfusion sensitization has a prolonged probability of excellent survival and leading a normal life. Age is the most important factor. The incidence of the disease graft versus host increases with age and exceeds 30% in those older than 30 years. After the bone marrow transplant of an HLA identical brother, more than 70% of the patients survive in the long term and can be considered cured. The response to immunosuppression in aplastic anemia is independent of age, but treatment is associated with higher mortality in older patients. The overall 5-year survival of aplastic anemia now reaches 70 to 90%, much better than a few years ago when survival was less than half. Derivation: it is a very important note that in all patients with aplastic anemia, referral to hematology is indicated. Thank you very much for watching the video. Subscribe and like the video. In the next video we will talk about sickle cell anemia. I hope this channel can help you guide you. Greetings.